Shame is a lifelong thing, and I think a lot of people power through it or mask how they're really feeling.
Dr Ayan Panja.
You've seen tens of thousands of patients.
He's breaking down the role of shame in ADHD.
Is shame or self-loathing a common theme amongst patients who have an ADHD diagnosis?
It'd be hard for me to think of someone I know with ADHD that doesn't have some shame or self-loathing. And I see this a lot with parents of children with ADHD. It's so challenging. And actually the best thing they can do is do the counterintuitive thing, which is actually, because shame now is actually in DSM-5. So DSM-5 is sort of the mental health classifications book. We know from research that people who are traumatised in their early life go on to have worse health outcomes all across the board, not just mental health, physical health as well.
What advice would you have for someone who is really in the pits of it with shame?
So the first thing to say is,
this episode is dedicated to anyone who, when they achieve something, doesn't feel any sense of accomplishment, only a mild sense of relief that it's done. I know you've probably heard this a million times on other podcasts, but following or subscribing really helps the show. And the more followers we get, the more likely it is that I'm able to book new, exciting, and insightful guests for the show. So, if you subscribe, I will continue to keep to my word and promise to never let this podcast be sponsored by Huel. Dr. Ayan, thank you so much for joining us.
it's great to be here. Thanks for having me, Alex.
Just to set the stage, how long have you been a GP and what position does that put you in when analysing common themes in the ADHD community?
It's a great question. So I've been doctoring, if you like, for 25 years, and I've been a GP for about 21 of those years now. So it goes quickly. And in terms of ADHD, I think, there are not many conditions or presentations that you see as a doctor that you notice the frequency sort of going up rapidly, apart from things like COVID, obviously, because that was something that we've never experienced before. And ADHD, the number of people that contact us every week now compared to even 10 years ago is astronomical. I mean, it's just not a week goes by where someone doesn't email in and say, either I think my child's got ADHD or I think I've got ADHD.
I know a lot of my listeners are women, and an issue that many people have faced is going their whole life without understanding why they work or think perhaps in a way that they consider to be societally normalised. And they're confused as to why they can't do certain things or why they can do certain things that other people perhaps struggle with. Why do you think it is that so many people were missed for so long?
15 years ago, when I was working in North London, there was a psychiatrist who used to work at St Anne's Hospital, and he told us about his best friend who was a surgeon in America. And he says, look, my best friend who's a surgeon, he's been diagnosed with adult ADHD. It was like a really rare thing. He was almost whispering it. And he goes, and then his son went to see the same psychiatrist and he got diagnosed with it. And then his daughter did, and then his wife did, and all four of them have got adult ADHD. And I remember putting my hand up, this was at a postgrad centre, and I said, why is it not diagnosed here apart from in the private sector? Is it just sort of fake thing, because I didn't really know that much about it. And he goes, no, I don't think it's fake. It's just, I'm sure it'll, we will catch up with America, I think is the phrase he used. And that's exactly what's happened. I'm not sort of demeaning the diagnosis. I think, there are real biological and social things that happen as a result of ADHD that impede people in their life, in terms of holding down a job or their relationships. And in terms of how it presents, there are some diseases like Lyme disease and syphilis that are called the great mimickers. And ADHD for me as a GP is one of those mimickers. It can present as almost anything. It can present as anger. It can present as anxiety. It can present as depression. But the why of the why is often, it was ADHD all along. Having said that, you put someone on an antidepressant medication and often they feel a lot better if they have ADHD. So it's pretty complicated and convoluted and really deeply interesting.
I mean, so interesting. I was diagnosed with generalized anxiety disorder when I was 15. I was in an AA meeting, my first AA meeting when I was 17. All of these things I strongly believe are because of my ADHD, but it wasn't until 20 years later that I realized that actually the ADHD was the main thing. And all of these other things below it were a cause or happening because of that.
Yeah, that's exactly it. And I think that's one of the reasons it's missed, because unless the public know that it's a thing, and unless doctors and healthcare professionals know it's a thing to look for, we're not really looking for it. Plus, the other thing is that it's difficult to treat. Actually, again, not maligning doctors at all, I prescribe antidepressants regularly. It's quite easy to treat anxiety and depression, in the sense that, if you're a really good practitioner, you want to really dig deep and get to the why of the why. But medication, talking therapies, we've got lots of tools that work.
Does medication work for those with ADHD?
I've seen some amazing results. I think my view, again, this isn't out of a journal or anything, this is just my view as a doctor who's seen lots of people with it over the years. It either sort of works or it doesn't. And that goes for any condition and any drug. If you take blood pressure, some people don't respond to blood pressure tablets at all. Other people, collapse after the first dose because it drops it too quickly. Same with depression and antidepressants. Everyone's biologically individual.
Is shame or self-loathing a common theme amongst patients who have an ADHD diagnosis?
It'd be hard for me to think of someone I know with ADHD that doesn't have some shame or self-loathing to a higher level than the next person, is what I mean. And the reason for it, I think, is that it starts at such a young age, So one of the referral criteria for GPs is you have to tick a box to say that the adult that you're referring had ADHD traits before the age of 12, and you have to get evidence from their parents or school reports, as well as the questionnaire, the ASRS. And it's not just a case of writing a letter. And so, if you are a child who has ADHD and that's undiagnosed, you are going to be told off, for want of a better phrase, for whatever it is: fidgeting, not sitting still, not concentrating, not remembering your violin, or whatever it is, those sorts of things. And that creates shame, and I see this a lot with parents of children with ADHD. It's so challenging. And actually the best thing they can do is do the counterintuitive thing, which is actually be really compassionate and sort of be really patient, because that's what helps a child with ADHD. Not scolding. It's the worst thing almost, because that's what triggers things like rejection sensitivity and that feeling of I'm not enough, or I'm if only I'd done this, or if only I'd done that. You end up in that sort of regret cycle. And it's interesting because shame now is actually in DSM-5. So DSM-5 is sort of the mental health classifications book, and shame is actually in it now, and it's described very medically as persistent negative emotions, and is one of the diagnostic criteria for PTSD, interestingly, post-traumatic stress disorder. So we know shame is bad for us. How bad is really difficult to measure. A very interesting thing, I think, is that we know from research that people who are traumatized in their early life and have what's called adverse childhood experiences go on to have worse health outcomes all across the board, not just mental health, physical health as well. But interestingly, Dr. Bessel van der Kolk, who is sort of a psychiatrist that specializes in trauma, in one of his pieces of work that he was writing about, they looked at a cohort of people who had lots of early life trauma. Every single one had a diagnosis of ADHD. And that then begs the question that, well, hang on, did they just have symptoms of ADHD and they got a label because it suited the doctor at the time? Or is there something going on in the brain development of a child who has some level of trauma that then means their neurodevelopment is affected, which makes them, gives them a propensity to developing ADHD? And I certainly can't answer that. It's probably a mixture of the two.
Why does trauma or adverse childhood experiences affect longevity?
Wow, that's a question. Yeah, there's lots of reasons. So one example is, say you have a child who goes through lots of traumatic experiences very, very early on, for example, in the first year of life. Now, sometimes that traumatic experience, the surge in stress hormones, even at that age, cortisol, for example, is so damaging to the cardiovascular system and the nervous system that it changes that child's lifetime risk of developing heart disease and type 2 diabetes just from the, it sounds almost like I'm making this up. It's absolutely true. A lot of other factors like attachment. So there's a really famous John Bowlby who writes a lot about attachment theory. And again, bad attachments lead to worse health outcomes. Most of it is to do with stress hormones. There are other factors as well. So if you have, and it starts before we're born, actually. So if you have a woman in pregnancy who's very stressed and has got a lot of stress hormones bounding around themselves, and then the baby's born premature, this is just an example, isn't breastfed for whatever reason, has added a bit of stress of some sort, and then has lots of antibiotics, for example, in early life, which affects your gut flora, that child I've just described is probably more likely to develop tummy ache and things like irritable bowel syndrome when they're older, or emotional problems, and is ADHD one of them? Well, there's a lot of debate about this. So someone recently has been on a podcast saying that sugar is a massive driver of ADHD. And as and the ADHD community quite rightly have really kicked off and said, sugar doesn't cause ADHD. It doesn't, but it's not going to help. That's the point. It's never one thing. It's everything that's non-communicable. So something that you don't catch from someone else, including ADHD, is down to a number of things. It's partly genetics, partly environment, partly stress, sleep, diet, exercise. All of those things feed into it. And everyone's story is individual. And I think I don't know about you, Alex, but if you trace your story back to early life, and people with ADHD often do this when they get a diagnosis. They think, wait a second, actually, I moved around schools quite a lot, or whatever. There's something in their story that makes them realize why they had to, why their behaviors manifested possibly, and that feeds partly into whether ADHD is actually a coping mechanism, but that's very debatable. So
it's so fascinating. Every time someone comes on or someone says something on social media that links trauma to ADHD, the community goes wild. And I got fascinated by that concept, and I really deep dived into the research. And the conclusion I came to is that nobody really knows. There's a consensus and there's theories, but nobody has a definitive answer of what causes. So if you were asked that question, what causes ADHD, what would you say?
What causes ADHD? It's multifactorial, like everything else. And it sounds really boring in a way, but it's never one thing. It's partly genetic, it's partly environment, partly the things that happen to us in our life, and partly what we do, things like sleep and stress and diet and exercise, all the boring but important things all feed into how bad, I guess, your ADHD symptoms might be. We definitely know there's a genetic link that's been written about. The bit that the scientists and doctors argue about is whether the inattention and the sensitivity is a reaction to some sort of pain avoidance. I was left with a babysitter that I really hated, or whatever the trauma is, and that fear of that happening again, potentially, some doctors believe kind of makes the child pull away.
Have you seen different ways that shame can manifest in people who have an ADHD diagnosis before and after they get the diagnosis?
Yes, I definitely have. Before the diagnosis, it's fascinating because I know people who I didn't know had ADHD and they didn't know had ADHD before they got a diagnosis. And you will have heard all of these before, but they tended to be erratic all over the place, could just walk out of a job, just, that sort of behavior, really high, really volatile. A lot of people would be described as that by friends and family, unreliable, all of that sort of stuff. And so those things I've just said, if I said them about you, I mean, you would feel shame, because it's like, oh, yeah, it's Alex, he's just unreliable, typical, he's late again, that sort of stuff. And it chips away at you. But once they get the diagnosis and they think, wait a second, there's a reason for all these things, there's nothing wrong with me. I think people grow up thinking, what is wrong with me? And often people will say that to them, like, what is wrong with you? Which is, other people don't, they're just words, aren't they? But if you're a sensitive person, those words, are like daggers, and they really cut deep, which then leads to anxiety and lots of emotional distress. But the other side, once they get the diagnosis, it's like someone's, switched the light on in a dark room and everything suddenly makes perfect sense. They're not perfect by any means, but they're just able to handle their shortcomings, if you like, or perceived shortcomings a lot better. But it doesn't fix the shame thing. Shame is a lifelong thing, really. It's not something you can just ignore. And I think a lot of people power through it or mask how they're really feeling. There's something already called trauma-focused care for people who are traumatized. And often they present at the doctor with multiple things going on, physical and emotional. And the medical model, however holistic we try to be, really tries to take each of those things separately and tries to treat them separately. And often we forget the person as a whole. But actually, shame-sensitive practice or shame-sensitive consulting, I think, is probably what is needed in the area of primary care, which is what I work in, and mental health, in terms of helping people with ADHD. I don't even know whether it's a real thing, but I think it is a thing because I've read bits about it, but it's not in the mainstream, whereas I think people's awareness of trauma, even that, we don't do very well. It's like, oh, well, they had a really terrible childhood, of course they've got heart disease, yeah, but, what can we do to help this person? And it's the same with ADHD, shame-sensitive practice. That is something that if anyone could campaign for in the community, that should be it.
What do you think the hidden costs of shame are?
The hidden cost, in fact, the hidden cost is really that you are primed to become ill, in whether that's mentally or physically. And I'm, with my medical hat, thinking of DSM-5 and their definition of shame and how it might be linked to PTSD. That's a very clinical way of looking at it. It's actually a feeling, isn't it? And feelings often come from thoughts. And so, it's like RSD. RSD is almost like recurrent, acute shame, isn't it? That is pretty much what it is. And you feel it so acutely and kind of, in your bones almost, don't you? And I think, because I've seen that happen in front of me. Someone just completely just crumpled into, like someone's just literally lit a fire and it just melt. And just that alone, what's happening to your sympathetic nervous system, what's happening to your blood pressure, your cortisol that we talked about with, the fictional story of the baby, is terrible. Terrible. It will drive all of those non-communicable diseases, high blood pressure, diabetes, constant anxiety. It's just no way to live.
So when someone has an episode of RSD, in that moment, are you sort of saying that they're being snapped back to a memory that's caused them immense shame?
My guess would be yes. If we're going on the theory that ADHD is linked to trauma, and I believe it is, and if you get 20 doctors in the room, they'd all have their own views, I think. That sort of visceral type response that you get with RSD is very much like people who get panic attacks or spider phobia or something. Suddenly, like it's absolutely like that, isn't it? And so something's triggering it. Very difficult to say what, but often it is an event from a long time ago that is just a sort of a distant memory, very similar to, I don't know whether you've read Philippa Perry's book on, the book you wish your parents had read and you wish your children will read or something. I've got that title wrong. Sorry, apologies. but that's really good on this in particular about how you react. She tells a story of one of her friends who's a psychotherapist and how her daughter got stuck up a tree and she got really annoyed with her. and I sort of thought, yeah, I think I would as well, actually. I was sort of reading it thinking, what would I do if it was one of my kids? And then she sort of reflected on it as you would as a psychotherapist and thought, actually, the reason I got annoyed is because my mum used to get annoyed with me for that. And then the next week they were in a park and there was a climbing frame and the little girl wanted to climb up the frame, was looking sort of nervously at mum, thinking, am I going to get told off again? And she had the sort of mind, she had the kind of insight to say, it's okay, you can go. I won't shout at you if you climb up the frame. And the reason I'm telling that story is that, if you're a child with ADHD, forget climbing up the tree, you're getting that all the time, a lot of the time for almost everything. And that's where I'm no good at this, I'm just useless, the shame comes from.
Well, it's almost quite a famous statistic now within the community, that 20,000 negative messages that kids with ADHD experience, 20,000 more negative messages than your neurotypical child.
Wow, I didn't know that. That's amazing.
Compound over time. And therefore, it's no surprise that when they grow up and are an adult, they're almost primed to be filled with shame and to react so visceral and aggressively internally when confronted with something that almost snaps them back to that perceived criticism or rejection.
Absolutely. And it's such a difficult thing. I think the really hard bit is it's really hard to, that is just I wouldn't say it's impossible to control. You can do it with a lot of cognitive techniques and practice and what I call flooding yourself with self-compassion. You have to almost, because actually my theory is that, someone without ADHD who I'm trying to sort of talk through how to manage panic attacks or whatever, I will say, okay, what you've got to do is see the word stop or whatever it is. And then I talk to them and rationally about your false belief is a false belief. And you have to kind of think, well, where does that negative thought come from? But actually someone with ADHD, because their brain is often fizzing around so quickly, will make something fit. They'll always find a reason. They'll go, no, actually X said this and so said that. It's definitely true. I am actually rubbish at turning up on time. It's almost like they become quite rigid because they genuinely believe it. It's much harder to uninstall. Do you know what I mean? It's sort of, it's not quite the same as someone who's neurotypical who has anxiety but not ADHD because the tools work more easily for them in a way.
Are there any other ways someone can flood themselves with self-compassion?
So the way I do it, and this is just a model that works for me and for most people I know, and I think works well for people with ADHD, is I talk about the three brains that we have, the sort of reptilian brain, the monkey brain, and the adult brain. And just the adult brain being the prefrontal cortex, which is the bit that makes decisions and executive function and all the bits that someone with ADHD can't do easily. Bear in mind, most of us, that prefrontal cortex doesn't get fully developed till your 20s or 30s sometimes in people without ADHD. So it takes ages to grow up. I kind of talk about a little bit like Prof. Steve Peters, what I call your monkey brain, or the little you, the little Ayan and the little Alex, and how they are feeling hurt when they're experiencing either RSD or something that's making them feel triggered. It's not you, it's sort of the little you or your monkey brain. And so Steve Peters uses this thing about the inner chimp and how you've got to be kind to it. And it's much easier to think of it as being a part of you and not you. I've had to do this. I don't have a diagnosis of ADHD, but I sometimes feel like this. A lot of people do, and I have to sort of deploy that thinking, okay, I'm really not feeling good. I really want to lose my rag, or I'm absolutely just, something will happen, and then I'll think, wait a minute, that is not me. That is little Ayan, when I was 6 or 7, or that is my inner monkey. And once you can sort of, and I did it recently the other day. I'm on a bit of a mini health kick at the moment. I'm trying to eat less treats, and I don't have that many anyway. But I was walking towards the cupboard the other day, and I thought, no, that's not me. That is my monkey brain. My monkey wants that snack, not me, because my grown-up brain doesn't want it because it knows it's bad for it. But little me, who's a bit tired and, wants a bit of comfort from something sweet, wants it. You know what I mean? And so it's very simple. Sometimes the simplest way to sort of get these things across works the best. If you sort of overcomplicate it and overthink it, you'll end up just impulsively doing the thing anyway. That's my method, but that's just me, not in any textbooks and no sort of masses of evidence base in the BMJ or anything about that. But that's just something that I found works.
I suppose sometimes those decisions that we impulsively make are the right ones, and they're things that we should do to progress in life. So I suppose the question is, how does one tell the difference between the monkey brain and the adult brain? Because sometimes it's a good idea to follow the impulse.
Yeah, I know exactly what you mean. And I think, again, with ADHD, because that impulse has, for want of better words, got you into trouble before, you think, wait, is this right? But also part of you will think, I know I'm right. This is definitely, but how many times has that gone wrong? Where you sort of, I don't know, buy something and it falls apart, because you just, it's a difficult one. I think many people with ADHD I know have always said to me, if they try and use process and logic, nothing works for them. They almost can't think like that because they're very instinct driven. And I can relate to that. But this thing about going with your gut and kind of going with your impulse, you everyone has got a different sort of hit rate, haven't they? And without kind of being down on yourself in terms of track record, if you know that, every time I do this, then this happens, and that outcome happens if I do X and Y, then your impulse kind of gets better, doesn't it? And yeah, it's a difficult one. I think if you can't really beat the basics though. If you haven't sort of done the basics, like you and I before we sort of started recording, we're talking about ideas. So I have lots of ideas, but they're just ideas. I'm probably never going to do anything with some of them. But someone who, if your impulse is telling you an idea is really good, the next step is actually doing something about it. So I think if the impulse is strong enough for you to feel that you would follow through and do it, like write a book, for example, very difficult thing to complete and finish if you have ADHD, you'll probably do it. I think, if you know you can follow through and that impulse is that strong and it's obviously a good idea, then, you're probably on the money.
Yes, so true. You sort of, I guess, pattern recognition can really help as well. And that probably comes with age. You can look back and see past behavior and see the results of the decisions that you've made. And you can gather the data from experience to say, okay, which impulsive decisions led to good outcomes and which impulsive decisions led to bad outcomes. And it's not a perfect solution, right? Because every week I still do something that I shouldn't have done. I buy another domain, or I don't pick up that jumper that's been on my floor for 2 months. Little things. Yeah. But at the same time, I now know to trust my intuition most of the time, and proportionately more things work out than not. And I think that's come from age and experience, and being able to sort of gather the data and to look at the history of decisions that I've made, and almost in the back of my head I've got enough data points to make an informed decision using them.
Yeah, I think that's exactly right. And it's sort of, some people would just call it wisdom and sort of, experience, as you just said. But my I'm curious about two things there. One is, do you, when you've done it right, do you sort of look back and metaphorically pat yourself on the back?
No, absolutely no sense of accomplishment whatsoever.
Really, yeah.
I mean, that's a whole other issue, isn't it? Like imposter syndrome, huge with me. No, I'm just relieved that it's done. And then it's on to the next thing. I know I can do it because things get done, but I don't feel any sense of accomplishment once they're done. It's always just the stress leaves me momentarily until it starts building because of the next thing that's coming.
Yeah. And some people would say, you know, someone I know who has ADHD always puts it in this way and says that he just loves the chase, but then actually once he sort of, the chase is over, he's bored and wants to move on. But I think that the rewarding yourself and patting yourself on the back is probably quite an important thing, because otherwise you're not recognizing that you did it, you know. And again, you know, for ADHD children particularly who've had numerous, as you said, you know, I didn't know that stat about the 20,000 extra negative comments. That's staggering, really. It slightly undoes that, I think. You know, it's part of that self-compassion, self-talk thing. I think it's important. Yeah. Or even if someone else says it to you. But does that work if someone else says, well done?
No. I mean, for me, it's very, this is my experience. And I know that I've put content out about this and it resonates. I achieve stuff. Sometimes I don't achieve stuff. When I do achieve stuff, there's no sense of reward. There's no sense of achievement. And even when else someone says like, oh, well done, Alex, there's almost a sense of like, oh, they're just saying that. They're just saying that to be nice. They don't actually mean that. I haven't done a good job. I've done a job, but it's not good. I've just got over the line. But they stack up. Like this podcast is a culmination of things that have been done and stacked up. And even in the face of that evidence, it still doesn't squash the feelings of imposter syndrome or the suspicion when someone says, like you said earlier, oh, you know, this is brilliant what you've done with the podcast. And in the back of my mind, it's like, do you really mean that? I mean, there's this suspicion that doesn't let me believe or feel any sense of accomplishment for whatever I do. And I think that's what drives me to always do more. And I think that's always been my driver. It's almost like an insecurity. It's like a compulsion to fight off this insecurity. Like I feel compelled to work. I can't watch a film. I can't chill out and go for a walk. I have to work and prove to myself and probably others that I am good enough. And I think that's always been my driver. And I'm sure that's not a healthy way of working, would you say?
It's a very familiar narrative, that, because I've heard that from people with ADHD before, and I can see it in people I know and a lot of my friends who have a few friends who have ADHD. And I do wonder whether that just comes from early life and people just expecting you not to, you know, to let them down or whatever you want to call it. Yeah, you can spend your whole life trying to sort of prove to yourself, you know, because obviously to the external world you're successful, but to yourself that you can do it, and it's a strange one. And because the next obvious question would be, do you think anything would ever satisfy that need of thinking, actually, you know what, I did this really well? You know, there's no right answer to that question, but
I honestly don't think there would, because I know that on paper I've done all the things that society says you need to do in order to be successful. You know, I founded and sold 2 multi-million-pound companies. I've done a TED Talk. I've got 1 million followers. But at the same time, behind the scenes, there's this constant feeling of inadequacy. And I always use alcohol to silence that. But yeah, there's this huge contradiction between the public-facing Alex and what I think other people think of me based on the evidence from what I hear and what I think of myself.
Yeah, it's something. I imagine it's very difficult to sit with, as in like they're completely dichotomous, aren't they? They don't. There's a massive mismatch. And again, I think very common in people with ADHD. But I think a lot of, I don't know, from what you're telling me, it's interesting. It sounds like that is the nub of it, isn't it? Is it a shame thing? Is that what this is? Is that, I don't know. I'm just putting it out there.
There's a lot of shame in there. And I think it's only recently that I've been brave enough to talk about the behind the scenes.
Yeah.
It's easy to say, done the TED Talk, sold the companies. But behind the scenes, it was chaotic and dangerous. Like the anxiety attacks, the self-medicating. Do you see a lot of people self-medicating?
Yeah, I do. Alcohol's a very common one. Cannabis is another one, because I think in the short term, they can appear to sort of slow your brain down. That's why people go for those two. But of course, they are both addictive by nature, and it's a hiding to nothing, because like you said, there's often no off switch. It's just, and actually, there is data on people who are addicted to cannabis are much more likely to have ADHD. So that again, you don't know which way round it is. It's a difficult chicken and egg thing. It's so interesting hearing that, because I do think that the approach for ADHD, it's one of those conditions where there's so many strands to it. There's the shame, there's the anxiety, there's the addiction, there's, it's not just one thing, is it? It's multifaceted. And I have also seen that people who've had talking therapies seem to do quite well. So having someone to, as you do publicly, but actually sort of let those feelings out, or say those things that only you would have kept in yourself for years and not told anyone about, seems to help. But and have you found that therapeutic, just sharing your story and how you feel?
Yeah, massively, because you hold a huge amount of shame in keeping it inside, because you almost feel like you're not being truthful or honest with people closest to you. Because even like the worst side of it, I kept from those nearest to me, let alone the people who, were commenting stuff on social media saying, "Oh, well done, Alex, well done." There was such a contradiction between that and what was actually, so that was causing me huge shame as well. I almost feel like I was betraying those closest to me as well.
Yeah. It's so terrible, isn't it? It's a meta thing. You sort of feel shame about the shame. That's the problem with it, isn't it? It's sort of, it can, unless you sort of break that cycle, and it's not called this, but I call it the cycle of regret, because again, this is something I hear from people with ADHD. It's like, oh, if only I'd worked a bit harder, or if only I'd got a bit more organised. But of course, it's not their fault. They haven't, but breaking that is really important.
I want to try the washing machine of Woes.
Okay.
I want to see what's in it this week, because I think it's a good one. I ask my Instagram community every week for their biggest ADHD woes, and I put it in this washing machine because for me, the washing machine symbolises one of my biggest woes, which is memory. I always forget to take my washing out of the machine. Do you forget your washing in the machine?
Yes, I do. And I do have some clothes on the floor. But,
it's that sock, isn't it? The dirty sock that you just walk past for 2 years. Right, here we go. In the washing machine this week. I'm a 15-year-old girl. I think I have ADHD, but the waiting list to be diagnosed is years. What can I do to settle my anxiety before then? Because right now, I just feel different and that nobody, including my teachers, understands me.
So really tough, and it's a tough time in life. There's so much going on just in terms of school life and, dare I say it, hormones as well. Everything's changing at that age, isn't it? The first thing is definitely sounds like she's talked to people, but no one's listening. And the main thing is talking to yourself, that thing about self-compassion. So if you think you've got ADHD, whatever's going on in your life, it's not your fault. So however you feel, whatever you're thinking, I would deploy my monkey brain tactic there, because at the age of 15, no one has a prefrontal cortex. They don't have the grown-up bit of their brain. And if you have ADHD, your monkey brain's going to be even stronger. So you'll feel emotions more deeply. You'll feel more sensitive than your friend that doesn't have ADHD. Your emotions will wax and wane, and it's okay to feel like that. I get the feeling that the anxiety sounds overwhelming from just reading between the lines, and that's a really difficult one. So it's a case of doing things as you've done, in fact, Alex, where you do things that make you feel calmer. So one that I sometimes tell my patients to do is called a 1-minute recharge. It's really good for ADHDers, actually, because it sort of separates different parts of the day. Or if you're feeling really stressed, so I do it when I pull up to work and when I pull up at home in my car, I sit for a minute and close my eyes and just breathe to kind of either prepare for what I'm about to walk into or sort of lose the stress of the day or whatever I've just encountered. Sounds silly, but it works really well. And the more you do it, the more by the end of that minute, you'll be able to feel a sense of calm, I hope. So that's one little micro tip thing. The other one is some practical things that you could do. It depends what's making her anxious. You know, if it's things like running late. So I think alarms and timers are really useful. You know, that's such a silly thing. But it can really change the trajectory of someone who's struggling with routine because you have reminders on your phone. We've all got phones. And the other one that a lot of people talk about, you know, a lot of influencers always talk about, oh, don't make lists. Actually, they really help with ADHD. Lists are brilliant, partly because if you can knock them off or cross them out metaphorically. So I use my notes function on my phone. It's so satisfying. And actually, you do sort of feel some accomplishment. You think, wait a minute, I've actually done that. That's gone. These are just really silly, quick wins. But the most important thing, if you're really feeling anxious, you should definitely go and report it to a healthcare professional because there is support out there. There are, you know, and as we said before, whether it's the ADHD driving the anxiety or not, just dialing down the anxiety using CBT techniques or, you know, relaxation exercises, breathing exercises or apps, or having real person support, that will no doubt help. You know, so wherever she lives, you know, they'll have some services there. So you don't have to sort of wait the 2 years or whatever it is for the ADHD diagnosis. There's lots of other things you can do. But I think the main thing is, if you're feeling anxious, is to definitely go and seek help. And just remember, whether you have ADHD or not, all of the things that are causing you anxiety are not your fault. You have to kind of be compassionate to yourself. Just whatever it is that works for you in terms of a mantra, every day you need to be kind to yourself and think of, you know, as I say, little Alex or little Ayan inside and just be kind to that child.
Brilliant. Really helpful. And I don't think there's anything silly about sitting in a car transitioning from one activity to the other. I think I do that all the time. I think 2 hours is my record in a supermarket car park before I have the energy to go in and deal with the overwhelm of deciding what I want for dinner. I ask all my guests for an item that most represents ADHD in their life. What's your item?
You're going to love this. I've got it in my pocket, actually, because I'm probably going to leave them here now. So my item is these fold-up sunglasses. And the reason is, my wife will tell you this, for a period of my life, I literally used to buy a pair of shades every month because I would just leave them somewhere. Or that thing, you know, when you put them on your T-shirt and you hug someone and they just snap. And I'd go to TK Maxx or wherever it is and just buy some sort of slightly designery but cheap and nasty ones. And then these, I got on a flight to San Francisco in 2017. So it's quite a long time ago, bearing in mind that's a long time ago. And I just thought these are the shades for me because they fold up so I can put them in my pocket. And I tend to put a lot of things in my pocket because I'm not going to lose them. So that's the story behind that.
Just finally, closing advice. If someone's listening and they're really struggling with shame and they feel embarrassed to tell people about how ADHD affects their life or their personal relationships are struggling, ultimately because of this horrible thing that so many in the community suffer with, which is shame, What advice would you have for someone listening who is really in the pits of it with shame?
So the first thing to say is everyone experiences shame to some level. And a really good starting point, I think, is to speak to a close friend or a confidant and genuinely ask them, is there anything in your life you've ever felt ashamed of? Obviously, that's a classic sort of, deep dive ADHD style, opener at the pub, isn't it? But actually, no, it's got to be the right context. You can't just spring it on them if they're, I don't know, on a hen night or something. But in the right context, that is and the reason that I think it's useful is you'll realise that I've done this with friends, and everyone's got something. It immediately sort of normalises your shame, and it makes you realise that, it's okay, because everyone has it. It's just that people with ADHD are more sensitive. They're highly sensitive people in a way. And that makes the shame feel a lot more acute. And again, it's understanding, my sort of, my noddy way of thinking about it is, my sort of, either little Ayan or my monkey brain is unhappy about this. It's not me, it's the monkey that's feeling the shame, not me. It's a cognitive trick just to sort of mean that, to slightly distance it from yourself. And also the second thing is that it's not real. It's as real as you make it and imagine it. You'll have friends who you'll think, oh gosh, how can he just walk around after doing what he did last week? But they haven't got ADHD, and actually they just don't think about it in the way that people with ADHD do. They sort of don't wallow in it. And I'm not saying people with ADHD do. It's just it feels much more acute and intense and deeply distressing at times. But you can attribute it to the fact that is just it's not real. And you have to keep telling yourself whatever works for you in terms of self-compassion, that you are valid, you are as good as any other person, and everyone has some degree of shame.
Really, really nice closing remarks. And it's a huge topic, and I know that that's going to help a lot of people. Just listening to you, I'm flashing back to moments where I felt incredible shame, and actually if I had those strategies in place then, maybe it would have alleviated some of that shame, and I could have gone a bit easier on myself. And I think it's so many people in the community really struggle with that, just giving themselves a hard time, beating themselves up too much over something that happened that wasn't their fault, diagnosed or not, whether you understand that it wasn't your fault or not. Such a point of friction. So to hear someone like yourself say it so delicately and gracefully, I think will be helping a lot of people. So thank you so much. We have a closing tradition on the podcast, and that is to ask the guest what your most impulsive thing you've ever done is.
Oh my God. How honest do you want me to be? Let's have a think. I think the most impulsive thing I ever did, and I don't know whether I've ever told anyone this, is years ago when I used to work in Tottenham, we used to have we had a very small number of staff, and so for the Christmas party, it was like whatever you want. We can go wherever you want, whatever you want, drink as much champagne as you want, whatever. And there was a taxi waiting to take a few of us to this venue, some gastro pub in Islington, I think. And we were really late, and I was the last one out, locking up. And Green Lanes, which is this very busy road in North London where my practice was, there was loads of traffic, and I just basically ran across and sort of jumped over the front of this guy's cycle and was about that far away from being hit by a truck. But the staff had already sort of had a few drinks. They were like, wow, you're like Superman. And I'm like, yeah, I am. But I remember my heart just would not stop pounding, thinking, God, I could have easily just died there. It was just a terrible, I don't know what happened. I just thought, we're really late. I've got to get going. And And yeah, for quite a while I was shaken up by the fact I did it, but probably not a very good one, but it stayed with me.
Classic risk-taking behaviour that is very common in the community. Dr. Ayan, thank you so much for your time.
Thank you so much for having me, Alex. I've really enjoyed it.